Welcome back to the second 15-minute lecture in psychopathology. Let's get started. So we just finished defining 6 of the symptoms of mental illness. They were distress, irrationality, unconventional or undesirable behavior or thoughts, maladaptiveness, unpredictability, and observer discomfort. And we looked a little bit at each one of those. Now, I need to tell you that you have to have 2 of the 6 symptoms present to be classified with a mental disorder. Remember, bullying, they already had 1 just because they're bullies. You have to have 2 to be considered having a mental disorder. So the question then is, how do you stack up? So let's see how you stack up. I can tell you now that you do not have a mental illness. I'll tell you why in just a little bit. But have you had a time in your life, let's ask you, think about it, have you had a time in your life when you felt blue for no apparent reason? That is certainly distress. Have you ever done something rather than study when you knew you should be studying? I think every one of you can say that that's the case. That's maladaptiveness. Have you ever had an experience in which you thought you saw or heard something that was not really there? This could be considered irrational. Have you had a flash of temper in which you said something that you later regretted? Oh, I think we can all say that. So that's considered unpredictable, and I'm sorry, we already have 2 and we already needed 2. Have you had unusual thoughts that you never told anyone about? That's unconventional. And have you distressed someone because of something you said or did? That's observer discomfort. So I would hazard to guess that you had more than 2 of those. Does that mean that you have a mental disorder? Of course not. Remember the definition of a pathology. So although everyone has experienced at least 2 of the etiologies on the previous page, a psychopathology, remember, is defined as any pattern of emotions, behaviors, and thoughts that are inappropriate to the situation, which lead to personal distress or the inability to achieve important goals. Most of the etiologies normal people experience are not persistent, nor do they lead to long-term distress or a loss of functioning or the inability to achieve their goals. They are temporary abnormalities which everyone experiences. So be comforted. You probably do not have a psychopathology, and if you do, and you are taking my class, you have gotten this far in life with it, so you really are managing it well. So then, if everyone has symptoms of mental illness, how do we diagnose a problem? A clinical diagnosis is the process of matching an individual's specific symptoms to those that define a particular mental disorder. The most widely used system is called the DSM-IV, and it is a book that classifies disorders by their mental and behavioral symptoms. And as of 2013, it is now the DSM-V. So the Diagnostic and Statistic Manual of Mental Disorders, the DSM, is the most widely accepted classification system in the United States, and it is owned by the American Medical Association. Remember, the AMA is medical doctors. It's a medical doctor association, which means that the DSM is owned by psychiatrists, not psychologists. The DSM-V, which is the 5th edition, was released in 2013, and there are some changes to the categorizations and names of pathologies, but personality disorders remained exactly the same as the DSM-IV. To perform a brief overview of the DSM classification system, we will talk about some major classifications. The neurotic disorders or neuroses were classified before the DSM-IV to describe a pattern of subjective distress or self-defeating behaviors that do not show signs of a brain abnormality or grossly irrational thinking, which would be used to classify the disorder differently. It specifically meant a neuron disorder, neurotic neuron disorder. Neurotic behavior behavior is no longer classified by the DSM, but that was a very controversial decision. According to Dr. Boree, professor emeritus at Shippensburg University, the effects of neurosis can involve anxiety, sadness, or depression, anger, irritability, and mental confusion, as well as behavioral symptoms such as impulsive and compulsive acts. It also can involve cognitive problems such as unpleasant or disturbing thoughts, repetition of thoughts and obsessions, habitual fantasizing, negativity, and cynicism. A worse diagnosis is the psychotic disorders. These involve symptoms that include a loss of contact with reality. They are disorders involving profound disturbances in perception, rational thinking, and affect or moods or emotions. So talking about the mood or emotions, we can have mood disorders. The mood disorders are abnormal disturbances in emotions or moods or affect, including bipolar and unipolar disorder, without the loss of reality, which comes with the psychotic disorders. Mood disorders are also called affective disorders because the term mood and affect mean the same thing. Bipolar disorder is a mental abnormality involving major swings of mood from mania to depression with very little, if any, time spent in normal mode. Mania is a pathological excessive elation or manic excitement. A person in this mood, in mania, may spend money and max out a credit card just for the pleasure of purchasing something that they don't actually need. If their credit card is maxed out and they see one lying around, they'll use it. They'll pick it up and take it, even though it isn't theirs. And they will give it no thought whatsoever of the legality of their actions. They are manic. They are not thinking straight. Remember, emotions trump thoughts. Depression, on the other side of the bipolar, is something all of you have heard about, or you know someone who is depressed. It's a pathological sadness or despair, and it is diagnosed at an average age of 15. And it is diagnosed 15% more today than it was 50 years ago. The unipolar depression is a form of depression that does not alternate with mania, so these people do not get manic, they're only depressed. Unipolar depression is the commonest of all diagnosed major mental disorders. It costs $43 billion in the United States alone. 1 in every 50 people diagnosed with the disorder succeeds in committing suicide. And it is 10 to 20 times greater than it was 50 years ago. Teenagers are more prone to acquire this disorder, and more women than men get depressed. Also, women tend to dwell on the causes of their depression, while men tend to distract themselves to forget it. A woman will call up her best friend and cry on the phone, and they'll talk about what's bothering her. She will actually get more depressed on the phone during the conversation in the initial part of the conversation, but she and her friend will work it out and they'll feel better by the end of the phone call. Can you see a man calling his best friend and crying about something that bothers him on the phone? Well, maybe in Italy, but not in the United States. In the United States, we would call up our friends and say, let's go kill something. So the man will feel better immediately, going out and killing things, hunting, forgetting about what it is that's causing his problem. However, when he returns from killing things, he will fall right back into the depression because he didn't deal with the issues the way the woman did. He only dealt with the symptoms, much like a drug does. So women deal with their depression better than men do. So what is it that causes depression? Could it be as simple as a genetic code for the creation of serotonin? The gene for serotonin comes in 2 sizes. There's a short version and a long version. If a person has 2 genes of the short version, then they are way more prone to depression than the others and are depressed much longer than those with 2 long genes. This is certainly a genetic or biological cause. The brain shows lower activity in the left frontal lobe of people who are depressed, so maybe it's just the way the brain works. You may also get depressed when you catch a cold, or when your thoughts turn dark, or if you have low self-esteem. Seasonal affective disorder is also a possible cause of depression. Seasonal affective disorder is also called SAD. SAD is believed to be caused by deprivation of sunlight, causing an imbalance in the melatonin and serotonin in the body, in the brain. SAD is a form of unipolar depression, and there's a doctor that's found some people with SAD who have a mutation in their eye, which does not allow their eye to respond properly to light. The eye actually converts sunlight into certain chemicals. And there are lots of variations in our biologies, and some people convert the sunlight well and others do not as well. If you do not convert the sunlight well, then you need to be exposed to more sun. Intense light therapy tends to reduce the symptoms of SAD, which gives credence to the belief that some people have that SAD is due to the lack of sunlight in the winter months. Intense light therapy is actually getting a light bulb that imitates the rays of the sun and then just sitting in the house with that light shining on you. So you should be able to tell me, just connecting what you know in the world to what you just heard, you should be able to tell me why people are exposed to less sunlight in the winter months. And it has nothing to do with staying inside because of the cold. Why is it that we have less sunlight in the winter months? Think about it. So 15% of the population has experienced symptoms of anxiety great enough to qualify as an anxiety disorder. It's more common than depression, but it is not diagnosed as often as depression. Depression is diagnosed much more. People don't go to the doctor when they're anxious. They do when they're depressed. Panic disorder is a type of anxiety marked by panic attacks that have no connection to events in a person's present experience. Panic disorder is also known as free-floating anxiety. It includes shaking, sweating, dizziness, racing heart, all for no reason. Again, it's more common in women than it is in men, and 2% of the population experiences this form of anxiety. A person can be walking down the street and for no obvious reason may feel like they are having a heart attack with chest pains and sweating and shaking, and they feel extremely anxious. Phobia or phobic disorders involve a pathological fear of specific objects or situations. It's a type of anxiety. 12.5% of the population suffers from some form of phobia. Social phobias are the most common type of fear. Many people fear some object as well, but it is not pathological. You may not like something, but you don't have a pathological fear of it. A person with a pathological fear or a phobia, let's say of spiders, may be walking down the sidewalk and see a spider, and they'll run into the street to get away from that spider, and they don't even think about the fact there are cars coming that could kill them. Again, this shows how emotions trump thoughts.